Hey guys, this is Coach Bolt from Phuket. Today we're going to go over a few uncommon tips and factors on why you're experiencing lower back pain and office syndrome. In this video, I'm going to discuss three things. 1, why you're experiencing the symptoms. 2, how to assess your own body. 3, how to create a protocol to get out of pain. So there are 2 uncommon reasons why your lower back stiffness or desk syndrome may be occurring. 1 can be stemming from tight hips. 2 could be coming from your fascia, having a very tight, restricted anterior front line. So we need to first assess your hips and see if it's functional. We need to understand, can your hip flex? Can it extend? Can it externally rotate, internally rotate? Can it abduct and adduct without compensating other parts of your body? So the fascia could be the second reason why you may be experiencing that lower back pain and or desk syndrome. If we're accustomed to sitting down all day, this is a result of a shortening of the superficial front line. To revert this from happening, we need to address all tissues that are associated with this front line so that we can recondition it and retrain it to hold better position, resulting in less compensation throughout the body and less pain. First, we're going to try to mobilize our hip. What do we do in regards to mobilizing our hip? We need to address the soft tissues firstly. How do we do that? Foam rolling. What I'm going to do is prescribe 3 to 5 minutes, depending on what tissue seems most restrictive to you. We're going to cycle through a few different tissues and see and feel what is giving us the most pain signals. By those pain signals, you're going to probably have the most restrictive tissue in those segments. First, we're going to address our glutes. You can start by rolling. You can start to feel where you may be getting a little bit of tightness, restrictive, by it being more painful than other areas. Once you find the place or position that may be more painful, you'll just sit there and breathe. You'll repeat this process on each side, left and right glute, approximately 1 to 2 minutes each side. Then we're going to move on to our quads. We'll roll up and down our quads like so. Again, for about 1 minute to 2 minutes on each quad. We'll slowly go up and down to determine our point of most resistance. When we can find that, we'll sit and breathe. Again, rinse and repeat, do with the other side. Secondarily, we'll go up into our abdominal region and in our hip flexor and psoas region. The abdominal region and our psoas hip flexors region also associate with our superficial front line. So you'll be able to address both systemic functions and failures via this release. All right guys, this is pails and rails for hip internal and external rotation in 90-90 position. First, we're gonna start off in 90-90 position. We're gonna place both legs like so. Front leg, we're gonna bring out front and bend our knees in a 90 degrees, and we're gonna duplicate that same angle in the trailing leg. We're gonna place a yoga block right underneath the knee. Our goal is to learn how to independently externally rotate and internally rotate this hip. We want to set up where our hips are parallel, our shoulders are parallel, our hands are straddling our legs. We're going to take a deep breath up, pack in our core. We're going to drive our hip forward and extend our hip at full capacity, utilizing our glute. Then we're going to drive our knee down into the block. This is an internal rotation isometric load for 10 seconds. I'm driving my glute forward and turning my knee downward into internal rotation. I'm going to count to 10. I'm at 3, 2, 1. I'm going to take a deep breath. I'm going to keep my glute contracted to pin my hip forward as I utilize my quad and hip flexors to rotate and externally rotate my femurs away from center. We're gonna hold maximum position for 10 seconds, and then we're gonna slowly internally rotate back onto the block. Again, we're gonna do a 10-second count. We're gonna push forward and drive down in internal rotation. Shh, shh. So my main focus is keeping my hips squared, my shoulders squared, my core packed, my glutes engaged. I'm rotating my quad forward and down into internal rotation. I'm going to take a deep breath. I'm going to restrict my core, restrict my hip, and then produce the external rotation. We're trying to lift up and away our knee from center line. Back down. Again, guys, this is pails and rails for internal and external rotation. So the second exercise following the 90-90 is to restore hip extension, right? So we want to isolate the hip, and we want the capacity for the hip to move in front of the torso without compensating the lumbar spine. So from here, we're going to get tall, belly in, and we're looking to drive our hip forward toward the wall. I'm utilizing the glute. I'm driving from my toe, and I'm driving for this hip to drive parallel with this wall, feeling like my hip flexors and my quads are stretching down toward the ground. I'm slightly rotating my right hip closer to the wall to maximize the stretch feeling. We're gonna hold for 10 seconds. 9, 8, 7, 6, 5, 4, 3. This is spinal stacking with the emphasis of lumbar and pelvis reconditioning. Our goal is to place all our spine flat onto the ground while holding our body in that position. Our goal is to try to keep on all systems while bracing. First, we're gonna retract the abdominal, turn our spinal erectors, which will create thoracic extension. Then lastly, we're gonna turn on our posterior pelvic tilt. So anywhere from 5 to 20 seconds in this hold should create an immense amount of tension in your body, and it should feel very difficult to hold. You should be struggling to identify with keeping the retraction of the belly, thoracic extension, and the glutes on simultaneously. My suggestion is to turn on each muscle grouping slowly and sequentially. All right, lastly, we're gonna try to reorientate our whole fascial system We're going to try to bring awareness of how our position is from our toes up to our head. Continuing from last exercise, all we're going to do is extend our leg down. So the extension of our legs downward should force your lower back to extend upwards off the ground slightly. So that extension is your lack of compensation and your tightness coming from your anterior or your front superficial line. So we need to be able to restore the length of this superficial front line while maintaining an upright position. So we're going to utilize the ground so that we can understand how we're stacked if we were to stand up. From the feet to our head, we want our knees to be directly above our ankle, our hips to be directly above our knees, our shoulders to be over our hips, and our cranial to be over our shoulders, without our spine compensating from the ground or the knees buckling off the floor. These are all different compensations showing your body's inability to just hold your body straight in a normal standing stance. So we're going to continuate that last exercise, but we're going to put additional awareness down to our lower body and keeping our knees extended. So we're going to have our knees extended, planted down to the ground. Now we're going to suck in our belly, turn on our thoracic extension. So you start to see my lower back lift off the ground. That's where we start to begin our posterior pelvic tilt so that we can realign our spine and pelvis. So now we're getting to where our legs are straight, knees are locked, back is flat, belly is in, chest is up. In the beginning, you might only be able to hold this position a few seconds. My firm suggestion is to learn how to engage each system independently first and then tack on additional awareness. So I would first start, say, with knees extended, understanding how to keep those knees extended. Then I'll add on my abdominal retraction. I'll try to keep my knees extended with my abdominal retraction. If I can do those two without compensations, I will start to add on my thoracic extension. Lastly, which is the most difficult, is being able to stand up straight and produce that posterior pelvic tilt, which will press your lower back down to the ground, thus decompressing your spine.